Hi, Dr. Sasse here from Sasse Surgical. So just wanted to address a question with respect to the COVID vaccine. I've had some questions directed to me go along the lines of, I'm over 50, I'm significantly overweight, or I'm at some age or some level of excess body weight. Should I get the COVID vaccine? Or should I wait, or perhaps are there risks of it that are not being talked about enough? So I did a pretty deep dive review and examined a couple of papers that have come out since the new year in 2021 that have examined all of the COVID vaccinations delivered in the United States and the outcomes of all of those vaccinations, which I think gives us some guidance now and some clarity about the risks of going ahead with the vaccine versus watchful waiting. And first of all, let me just cut to the chase. The answer is a very clear, resounding yes. You should definitely get the COVID vaccine when you have it available to you, when your category and your state kind of tells you that your time is up, that you're available to go get it. I strongly advise you to go get it based on the data that has been published and the experience to date. So first of all, let's look at the benefits. Clearly, both the Moderna and the Pfizer vaccine are highly effective at the most important thing, which is preventing death and preventing illness from the COVID vaccine, from the COVID virus. So that data is now very unmistakable. There's a huge reduction in your risk of getting very sick with COVID or dying from COVID. It's unmistakable. It appears to be in the range of 90% reduction, which is absolutely fantastic, better than many other success stories for other vaccines that we commonly take. But there's more to that story beyond that. So aside from reducing your risk of death and reducing your risk of serious illness, being in the hospital, etc., there's a real emerging recognition that COVID in many cases leads to some prolonged and possibly chronic abnormal function that may be lasting for months or years, we don't know. That may be the residual effects of the COVID and recovery from the illness. So we're starting to see people having brain fog and cognitive dysfunction, ongoing pulmonary problems, and a number of lingering and probably permanent cardiac abnormalities after people have recovered from COVID. Time is going to tell how severe, how prolonged, and how impactful these are, but there's no doubt that there's a subset of people who recover from COVID, but who then are going to go on to continue suffering in some chronic way from the virus. So any precaution that you can take to avoid this is a huge benefit to you, and these vaccines are delivering on that promise and in a very effective way. We think the Johnson & Johnson vaccine will do the same based on the studies so far, and it's been approved under that same kind of guidance. So I would advise people to get all of the above. What about the risk side? What are the risks of getting the vaccine? Well, those risks are proving to be exceptionally low. Of all the people who have died after receiving a vaccine in the United States, to date, none of those deaths have been attributed to the vaccine. So as you can imagine, when you deliver millions of doses of vaccine and you follow people, there's going to be people who pass away because of the natural course of their lives. But so far, none of those deaths have been attributed to the vaccine. And so that's pretty remarkable, indicating that this is an exceptionally safe vaccine. Secondly, you do hear in the community with so many people being vaccinated that there are some reactions to it, and sometimes those are pretty strong. My wife had pretty severe reaction where she experienced profound fatigue and muscle aches, but it was gone in about 48 hours. And I've had colleagues who had similar experiences. And in the data, about 1 in 4 to 1 in 5 individuals will experience a pretty severe reaction along those lines. And it may involve headaches and profound fatigue and muscle aches and possibly fevers, and it might keep you from going to work for a day or two, but these are short-lived and they completely resolve. The possibility of an anaphylactic reaction does exist with this vaccine as well as with any vaccine. That risk has proven exceptionally low. nearly all of the cases of that, which I believe have numbered under 100, have occurred within the first 15 minutes of administering the vaccine. So nearly every vaccination center has a policy where the person is expected to stay put and wait for 15 minutes before driving off or before leaving the premises, just in case a person were to get that kind of reaction. And if you're not familiar with that, it means that it can cause a whole body allergic reaction, including difficulty breathing, wheezing, and could potentially be fatal if it was not treated. The centers that deliver vaccine also have epinephrine, which is the rescue drug to reverse anaphylaxis should that rare event occur. I would also say that there's a lot of misinformation, of course. We all know that. There's all kinds of misinformation online. There's a kind of a notion that, there may be some spooky side effects that are going on. And I honestly have not seen any evidence of that. Looking pretty closely through the published literature, which I do trust, I have not seen that there are additional side effects of the vaccines or things that we should be worrying about beyond those that are being reported and that we do know of. I would say, however, that there is often a very lousy appreciation of the risks of getting COVID, in part because of a few things that are the way our brains are wired. For one thing, the people who get really sick from it are at the hospital and they're kind of out of sight, out of mind, and so we aren't interacting with them. Also, the people who have passed away, the 500,000 Americans who've passed away, they're no longer here to tell their story, and so their voices, as much as we want to remember them and as much as we do hear about them and from our loved ones, their voices are diminished, and we are more around people who have not gotten the disease or who got very mild cases. And so there's a real selection bias of the kind of information that we hear, unfortunately, when this kind of thing happens. Also, I think that studies have shown that we are not really very well equipped at judging the level of risk. And so something that happens very rarely, such as a shark attack, is very scary and alarming, and that tends to kind of make us fear going to the beach and going in the ocean. But really that's an exceptionally rare event, whereas getting COVID and dying from COVID, as 500,000 people have experienced, is not so rare, and the risks of that are quite high relative to many other risks that we face in our life. So helping kind of locate where that risk is, I think, may help people make a better decision. But based on all the evidence to date, there's every reason to move forward and get your COVID vaccine as soon as it's available to you. If you are over 50 and you are overweight, then you are in a very high risk category for, if you get COVID, it might be a much more severe course of the disease and have a much higher risk of mortality than if you were younger and skinnier, which is far fewer of those people wind up in the hospital or getting sick. The data on that are very skewed. The vast majority of the deaths in the United States are people over 50, and high percentage over 60 and over 70. Every decade increases the odds of mortality. So if you're in those categories, then it's even more important to get the vaccine. The last thing I would add is that it's not just you. It's not just about me. It's not just about you. It's about everyone. It's about your loved ones. It's about your elderly neighbors or your neighbors who have vulnerabilities, and that any of us can be an asymptomatic vector or carrier of the COVID to them, and they may be the ones who actually suffer the result of us not getting the vaccine. So it is more about protecting your community and your family and your loved ones than even perhaps about yourself. So think of all of those factors as you weigh your decision, but as I say, I think it will reduce your personal risks quite a bit as well as your community risks, and so I advise you to move ahead and get it. So with that, I wish you the best of health.